I will be packaging up a specimen to send out to the outside lab. So we have spun our blood in our serum separator tube with a balanced weight. And we have properly labeled it with the patient name as well as a stool sample, this patient's name and our account number. And we're going to be putting these in syringe casings so they don't get damaged during shipment. We will put them inside a bag. That way, if they do become damaged, they're contained. We'll seal it up. We put the pet's information and paperwork request form in an outside portion of the bag. We place it in a box for shipment. And we're going to place it in the refrigerator and wait for the courier to pick it up. I will be performing maintenance on one of our in-house lab machines, our CBC. It's a IDEX laser site, and we just received a new test kit. So what we want to do is take out some of the old tubes, and we also just kind of want to wipe down and dust the inside of the machine, and then replace the new tubes, and they're all color coded on the side. And then when we draw blood, we'll actually put in a gray top tube and the EDTA tube and run the blood panel. So we'll just put this away and we'll throw away these. We pull out the filter and it collects dust, so you just want to clean it up. If it's excessively dirty, then we can run it underwater and let it air dry, but it's not too bad this time, so we can just replace it. And we do this monthly. And then we can wipe down the outside of the machine. And then in this compartment, we have the waste reagent. We can empty that. And then continue to wipe down the inside of this compartment. And when this bottle runs empty, the computer shows us that we need to change to the sheath reagent. And that's our monthly maintenance. I will be running an ELISA test on a dog named Hannah for her heartworm test. So we are actually going to be taking 4 drops of the diluent into the container, and then three drops of blood, and then we place a cap on the container and gently invert it, and then pour it into the well. And then we wait for the blood to move across the window and into the second window, and then we can snap down the test, and then it'll continue to flow, and there's going to be a control dot that'll show up to know that the test is working properly. This test tests for heartworm and 3 tick-borne diseases, and then once we are able to snap it down, we start the timer.
Thank you, guys.
Okay, and then we snap the test and start the timer.
Okay.
I will be obtaining an ear cytology from this dog here, Annie. So we will just stick in the swab ever so gently down in her ear canal, and we're going to take the discharge and just roll it on the slide, and then we will be looking at it under the microscope shortly. Okay, and now I will be heat fixing our ear cytology onto the slide, so we'll just run a little heat under it, and then we'll dip it in the fixative of our Dip Quick stain, and we just want to dip it approximately 10 times until the solution is on the slide nice and even. And we just let it drip off there a little bit, transfer it, and again repeating till it's on the slide nice and even about 10 times. And then into the last stain. And this is where we rinse it, just a little stream of water, and then running along, getting all the excess off of the slide, and let the slide dry a little, and then we will put it on the stage for the microscope viewing. Now that we have our ear cytology ready to read, we'll just slide it onto the stage of the microscope, and we have, we'll just turn the light on, and then with the coarse adjustment and the fine adjustment, we can just make sure it's nice and focused on the smallest objective lens, the 4x multiplication or magnification. And then once that's nice and focused, we can move it up to the 10x. And again, adjusting the fine coarse, or the fine adjustment until it's in focus and clear again. And then we'll move it up to the 40x. And sometimes by this point we need to add a little more light coming into the view. And again, it's nice and focused. And so on the 100, we add immersion oil. So we'll just add a drop of that. And then we rotate it to the 100. And then we just, again, with a fine adjustment, adjust till there's a clear picture. And what I'm looking for is either cocci bacteria, which are spherical or round bacteria, or rods, which are bacilli, and they're kind of cone-like, or we can look for yeast, which is it can be described as like a footprint or a snowman or a peanut shape. Some of those are the more common descriptions. And what we have are cocci bacteria in here. So then we can use the appropriate medication for his ear infection.
Thank you.
Alright, we have our patient here. He is died for unknown reasons, so we are going to do a necropsy. We're gowned up. We have masks and gloves to keep zoonotic diseases away from ourselves and keep contaminations away from him while we're trying to collect samples and send them off. So we have a sterile pack of instruments here. I think you can shut it off for a second.
Into the abdomen here. Now open all the way up here to his chest. His liver looks good, all his bowels look fine, not any bladder. All the bowel looks very normal. A little normal stool. I'm going to collect a little sample of spleen here. A little sample of liver. I'm going to try to get to his lungs. Pneumonias are a pretty common cause of problems in rats. The lungs are really dark and hemorrhagic and consolidated. Really dark. I don't see any lymph nodes that are large. And we'll just get a sample. We'll take his left kidney here, and that should be pretty representative. Okay. Anything else to sample? Actually here, the thymus, we should take a little piece of that too. A little viral disease you might find there. Okay. That should be all we need to figure out why this guy died.
I have some supplies for the handling and safety precautions taken when collecting a rabies specimen for submission for testing. So we have goggles, a mask, gloves, a gown on to keep ourselves safe. The rabies virus is not pathogenic when it is dried. So if it's in the form of saliva or blood, once that's dry, then it's non-infectious. So we just need to care for ourselves while we're taking and collecting the sample. So we do it on a drain table to clean easily. A lot of times we'll have the body in a cadaver bag, and then we have a biohazard bag that the head is placed in, and it's knotted up, placed in the bucket with ice packs. We do not freeze, we just refrigerate the sample. And then we also in here have some absorbent material in case the bag leaks. You close up the bucket, seal it up, fill out the paperwork that describes the person that was bit, the incident that happened, the information. Place that in the bag, tape it to the top of the bucket. Place the bucket inside of the box. Affix a refrigeration sticker and the mailing address, and then in several days the state will contact us with the results. I will be obtaining a vaginal cytology on a dog here, so we just want to take a sterile cotton swab, and I've added some sterile saline to the tip of it, and we just want to enter in kind of horizontally and then go at a 45-degree angle upward and kind of roll the swab around and then just gently roll it onto the slide, and then we let it air dry, and then we will be staining it. I will be staining our vaginal cytology slide. So we've let the slide dry, and then we're just going to dip it in the fixative of our dip quick, and we're just going to dip in here about 10 times until the solution runs nice and easily, covers and coats the whole slide. And then we just dry off the excess on the corner, transfer to the next solution. Repeat with the third stain. And then we will rinse off the excess with just a slow stream of water. And then dry off the back of the slide. And then we'll just let this dry a little bit, and then we will put it on the microscope for viewing the cells. So I have here my vaginal cytology that I'm going to be looking at, and we're going to be determining if this dog is in anestrus, proestrus, estrus, or metaestrus. And with anestrus, we're going to see non-cornified squamous epithelial cells, which are rounded edges with rounded nucleus and basophilic cytoplasm. There's no erythrocytes that are seen. In proestrus, we start to see, at the beginning of it, we still see non-cornified epithelial cells with lots, and gradually with lots of erythrocytes, and through the progression of the proestrus phase, we start to see those epithelial cells starting to become more cornified, so rough edges, no nucleus, and over that time change, we see less and less erythrocytes. In estrus, still the cornified epithelial cells, no nucleus, very few erythrocytes. And then back to metaestrus, it's very similar to anestrus, so you're starting to see non-cornified epithelial cells and no erythrocytes. So you can kind of determine at what stage the estrus is by seeing what are on the slide, what cells are on the slide. So we'll just turn the microscope on, and we want to start out with the lowest objective lens, which is our 4x, and then just looking in here, you can start out with a coarse objective, or the coarse focus, and then move to the fine one until your objects are nice and clear in here. And then we move up to the 10x, and again just making sure our view is nice and clear. And then to the 40, and still again just focusing your image. Sometimes you have to add a little more light to your subject. And then up on the 100x, and this is where you would want to add immersion oil. So we'll add a little bit of that. And focus in. And this dog was considering this dog was a very young dog and she had not had a heat cycle yet, I'm gonna, even though it's kind of difficult to discern between anestrus and metaestrus, I'm just gonna say that she's in metaestrus right now. Alright, we are going to be doing a transfusion shortly on a dog, so we just want to make sure that there won't be any problems, so we're going to work on some cross-matching here. So I have drawn blood from the recipient, an EDTA tube, and a serum separator tube, as well as the same thing from the donor, a serum separator and an EDTA tube. And we've allowed the serum separator to clot. So now we are going to spin those. We'll just put them on counterweights of each other, as well as we are going to spin down the EDTA. So we want to set this at 3,400 RPM, and we will set a timer for 10 minutes. And we will wait for that. Now that our timer is beeped and we're going to turn off the centrifuge, we are going to be removing, once this finishes slowing down, we are going to be removing the serum separator tubes, and this one's labeled recipient, so we are going to pull off the serum out of the tube, and then place that in a plain red top tube. And we will repeat with the donor serum, the same process. Now we have, after spinning the EDTA tubes, we are going to decant the plasma. And we will just take a drop or two of the red blood cells. We'll make sure that we have it matched up. I have a D on this tube and donor tube. And then so we'll drop those erythrocytes in there. And we will repeat the process with the recipient EDTA plasma. So we will decant the plasma, and then we will pull a few erythrocytes up into our glass test tube. And then we're going to fill the rest of these test tubes with sterile sodium chloride. Now that we fill both of these up with saline, we are just going to put them back in the centrifuge and spin them for 1 minute at 300 or 3,400 RPM, and then okay, now this is done spinning. We're going to turn it off and remove our saline and erythrocyte solution. So that's nice and clear, and we are just going to pull off all of this saline. And we are going to add fill this test tube back up with an additional amount of saline. Gently mixing, and we're going to repeat the process with the donor tube. Okay, and we have mixed more saline with our erythrocytes, so we are going to centrifuge them again for 1 minute at 3,400 RPM. So we'll set the timer. So now our timer has gone off, and we will remove these from the centrifuge. And again, hopefully our saline solution will be nice and clear, and the red blood cells will have moved down towards the bottom of the test tubes. And that is true. Although we still are going to be repeating this wash process one more time. So we will decant the saline. Be doing the same with the recipient's solution here. Okay, and then we will add some more sterile saline to these tubes and spin them down for 1 more minute. Now we are going to be making a recipient solution, erythrocyte solution. So we're going to be taking 0.2 mLs of the red blood cells. And I don't have a great way to be getting the sample, so just going to be drawing these up in here. Okay, and then we will place it into a fresh test tube, these erythrocytes, and we will add 0.9 mLs of sterile saline. And we want to gently mix. Okay, now we are going to be doing our major and minor cross match. We are going to be doing some controls on the recipient and donor samples to make sure that there's not autoagglutination. So to start with, we have a erythrocyte solution with the recipient. So we are going to take 2 drops into the control. Well, and then we will also, for the minor cross match, we will be taking 2 drops of the recipient solution. And we will take 2 drops of the donor serum into the minor cross match. And as long as we have it, we will put 2 drops into the donor control tube. And then for the donor solution, we will take 2 drops into the donor control tube and 2 drops into the major cross-match tube. And then we will take the recipient serum and mix 2 drops into the major cross-match tube, as well as 2 drops of serum into the control solution. Okay, now we give these tubes a gentle shake and we let them incubate for 30 minutes at room temperature. Now that these tubes have incubated for 30 minutes, we are going to centrifuge them again. So and we will centrifuge them for 1 minute on 3400 RPM. Okay, now that these have been spinning and the timer is going off, we are going to check for any visible hemolysis. It's especially important with control. We want to make sure that there was not any errors in our process, and double checking for auto-agglutination. So in the donor control, this serum is nice and clear, it's not hemolyzed, as well as in the recipient control, just matches the color of the serum that we have. And the minor control is the minor cross match is clear, as well as the major. Just want to kind of tap on the edge and make sure there's not any hemolysis, and there is not. So we still want to double check that we don't have any agglutination through the microscope. So we will put a drop on the slide of the minor cross match, and we will do the same with the major. And I will label these tubes major and minor, or these slides major and minor, so I do not get them confused. And we'll take these over to the microscope and examine them. Okay, now that we have our sample on the microscope slide, we are just going to make sure that we are in focus on the 4x objective lens And then we are going to advance to the 10X, making sure our erythrocytes are nice and focused. And they are all in, and we're going to go up to 40X. And they are all evenly dispersed among the slide. There is no rouleau, which is kind of stacking, or any agglutination, which would be clumping or bridging. And next we're going to view the major cross match. And again, we want to make sure our cells are in focus before advancing to the next objective lens. And we will move up to 10X. And the 40X. And our erythrocytes are nice and evenly dispersed among this slide, and we have, again, no agglutination or rouleau on this slide. I have Levi here. We're going to do a little skin scraping on this hair loss region on his skin. So I have a 10 blade over here, a microscope slide with some mineral oil on it. So we're just going to dip the blade in a little mineral oil, and then just in a perpendicular fashion to the skin, rub back and forth. And we want to get down to the capillary layer of the skin to grasp any mites that may live in his skin. And then we take some of that debris on here and just mix it in with the mineral oil. And then we will add a cover slip to the top of that and look at it under the microscope. So now that we have a microscope cover slip over, or the cover slip over the slide, we are going to turn on our microscope, stage our slide, get it into the center of the light here. And then with our 4X objective lens, we're just going to make sure it's in focus. If it's not, we can use the coarse focus and then the fine focus. And just scan around back and forth for mites. Two of the most common mites would be Demodex, and they are cigar shaped or alligator shaped with short legs. And then Sarcoptes is the other one, and they are round bodied with short legs. They are very difficult to find, and those pets are often very itchy.